Good afternoon. I'm Jana Martin, Chief Executive Officer of the American Insurance Trust, known to most of you simply as the Trust. We are delighted that you're able to join us today for this important and timely webinar series, Turning Toward Ourselves and Each Other, the Pivotal Nature of Clinician Self-Care. Part 1, which was held exactly 2 weeks ago, was titled, Understanding the Stakes and Recognizing the Terrain. Today, we'll be covering part 2, which is titled Restoring and Sustaining Clinician Well-Being. Today's webinar is being presented by Dr. Liesl Bryant. Some of you may know Dr. Bryant as a risk management consultant for the Trust's Advocate 800 program. In the interest of time, we've placed her bio on a slide for you. We're very fortunate to have her with us today. Now, let's turn to Dr. Liesl Bryant. I know that you will enjoy her presentation today as she teaches us the second part of self-care. Dr. Bryant, it looks like everything's ready to go, so I'll see you at the end for the Q&A. Thank you for your time with us in advance.
Yeah, thanks, Jana. Thanks for that introduction, and welcome to all of you. I know some of you were here for part 1 and some of you are just joining us today. So glad to have you, and I'm excited to be able to present on this topic and really to do the second half to the one that we started last week. As Jana mentioned, today we're focusing on restoring and sustaining clinician well-being. And so there's going to be, I want to give you just a heads up of a couple different things we're going to do today. There'll be, I think we have a total of 3 polls, interactive polls. So at various points, I will be asking for your participation in those polls. I'll let you know and explain that as we go. Also, we're going to do, at a couple different moments, we're going to do some exercises where I'm going to ask you to do, most of them are sort of close your eyes and do various exercises. But partly because we want to practice as we're doing this, you know, what are some of the tools, be able to use them. And also, like, the ones that we're going to use are very, very short. And so, you know, I want all of us to sort of get that sense that it's very doable to fit in these short little things that actually can make a big impact on our overall presence and well-being. And then also, as we go through, and you'll see this at various places, I'm going to pause. We have different slides on sort of raising some questions to help you build your own self-care plan, to really design that. And so there'll be questions about that. I won't be asking for your feedback in the program on that, right? That's going to be for you to sort of do on your own. But there will be various places throughout today's presentation where we will pause and sort of look at that so that hopefully you can start reflecting in that way now, and then we can gradually build on that as we go through the workshop. And then by the end, you will have, you know, you'll have made a lot of progress in terms of focusing on your own plan and be able to really enact that moving forward. So those are my hopes for today. In terms of learning objectives, one, we're going to start by looking at what are some of the barriers to effective self-care. We're also then going to look at the concept of lived self-care, what it is and what it isn't, and why it matters. We are going to identify various strategies for self-monitoring and self-assessment. And we're also going to talk about what the limitations of self-assessment only are, because they're quite significant. And then we'll also talk some about what the solution to those limitations can be. We are going to look at multiple, far more than 5, but specific strategies for moving out of burnout and related conditions, and really for revitalization and increasing our resilience and well-being. So we're going to look at each of those and go through those. We are also going to look at the role of self-compassion. There's been a lot of literature on this recently, a lot of research, and so we're going to go into that, see its connection to the promotion of wellness, and then also we're going to identify some of the key components of resilience as well. And as I mentioned, as we go through, I'll be sort of asking you questions. By the end, you'll be well on your way towards designing your own personalized self-care plan. So that said, I want to start with one exercise, both to ground us, to get us sort of fully here in the moment, and also to start from this place of nourishment. So if you will, just take a moment. You can keep your eyes open, you can close your eyes, but ideally just take a moment to come into your own sort of body, your own presence, and just start taking some deep breaths. Full inhales. You can think of it as breathing belly, ribs, chest, really taking in a full inhale. And then releasing the breath fully, letting all the air out. As you take the next breath, again, nice full inhale, belly, chest. You can check in, take a moment just to check in with your body. Just be present to whatever arises, any sensations, feelings. No judgment here, just really allowing whatever it is, checking in. Your next inhale, you can suspend the breath just for a moment at the top of the inhale. And then fully exhale, really letting yourself come here fully into the present. And this time, as you continue breathing, really just settling in and breathing, this time I want you to bring to mind a situation. It can be a clinical situation or some other kind of experience or situation. But something in the past week where you felt truly nourished in mind, body, and soul. Something that was really nourishing. And if you have trouble identifying a situation, you can think too of even just small forms of nourishment. So possibly a satisfying meal, a moment of connecting either with a client or with a colleague, a friend or family member, or possibly an instance of feeling connected to nature or something beautiful, beauty in some way. As you pull this to mind, I want you to really recall how the experience felt in your body, how it felt physically. Also, how it felt in your heart and mind. Really try to bring it to life. And then as best you can, allow yourself to really receive the nourishment from it, as if receiving a gift. Really let yourself honor it, this moment of nourishment, and perhaps even create a special place for it internally, where you really let it in and soak it in. And throughout the rest of your day today and during this webinar, you can continue to return to this moment of nourishment at sort of regular intervals and let it really feed you and let yourself savor the richness of that experience. Go ahead and take one final nice deep inhale, settling fully here in the moment, back in the present. And then exhale. And welcome again. So that exercise that we just did, and I made a note here on your screen, it comes from what's called the anti-burnout card deck. And this is a card deck, literal. I will show you guys. This is what the cards look like. That's the front of the card, and that's the back of the card. This is a deck created by Laura Warren, Mitch Ablett, and Christopher Willard. And it's just another sample of these little things you can do. I think the deck maybe has 52 cards, I'm not sure, but it's really intended to help us as clinicians approach our days and our works with sort of compassion and freshness. There's various exercises that help us deal with challenging clients or difficult moments. Some are just focused on self-compassion and mindfulness. So there's a whole variety of them. We're going to do some of them as we go through today. But I really want, I want to just practice it, right? Because we as clinicians sometimes don't take the time, like in this instance, to really receive nourishment and to give that to ourselves. And also that I really want, one of the main points here is to recognize, and we'll talk more about this as we go through, but how these small moments, what we just did didn't take very long at all, a couple of moments at the most. And how that if we continue to do that, that can actually have a really significant impact. And they're very small, easy actions to do. It's not that we have to go somewhere, we don't have to have some thing to do them. We can do these very, very small moments in short time periods and have pretty significant effects. So in terms of where we want to start, or where I want to start today, I want to think for a moment just about our entryway into the material and really set us up. I love this quote from Louis Cozolino. For those of you who don't know, he's a neuropsychologist and studies a lot of neuroscience. He's written multiple books. And he says, "We are not survival of the fittest, we are survival of the nurtured." And I think this is a really profound quote. I know sometimes I think some colleagues I talk with tend to have a reaction to that. Ooh, nurtured, who needs nurturing? But of course we all need nurturing. And what's pretty amazing, I think, is that the neuroscience, which we're going to talk some about later today, is really showing that in fact this is true, how much this is true, that we're not survival of the fittest, we are survival of the nurtured. And that really looking to nurture ourselves, and as we're going to talk later on, nurturing each other, can have really profound effects on our day-to-day well-being. And then, of course, on our ability to care and work with the folks that we're working with, our clients or our patients. The other quote I want us to hold in mind as we get going here and throughout the webinar is the one from Arthur Ashe. It says, "Start where you are, use what you have, and do what you can." And I think this is really important because I think a lot of times when we start looking at self-care, sometimes it can start to feel overwhelming. It can feel like that to-do list that I never get to. We're going to talk about multiple strategies and techniques that we can use. And you may feel like, yeah, I'm using those. Or you may feel like, oh, I'm not using those. And there's so much that I'm not doing. Today really isn't about that. Ideally, self-care won't be about that, but I really do want all of us to sort of start where we are, right? We're just going to take ourselves right where we are and move from there. So consistent with self-care too, we want to really be kind and gentle with ourselves as we move through this. Self-judgment often comes up when we start talking about self-care. It's sort of right there in the background, pretty quick to dive in. So just be really mindful of that. And if it does start to sort of creep in, then just be, again, kind and gentle with yourself and set that aside. This is not about judging ourselves right now. Self-care, of course, is a mindset and a lifelong practice. We're never going to get it, quote unquote, right. It's always a practice. And just like, for those of us who do meditation practices, there are days that are easy and days that are challenging, and there's no one right way to do self-care. And so we need to allow for that. Also, it's funny sometimes when I do these workshops, I'll give examples, I'll say various things, and sort of inevitably I have someone who writes in who says, oh, well, you said to do X, Y, and Z, meditation or whatever I might have mentioned, but that doesn't work for me. And I want to be really clear that any sort of strategy or technique we talk about today, it's not a prescription for you individually. These are ideas. Self-care really is individualized and personalized. We talked some about that last time, and it has to be, because what works for you is different than what works for me, than what works for somebody else. And so I'm going to give you as much information as I can today to give you tools, but you really have to figure out which one works for you. And I would, in fact, which ones work for you. We're going to talk about that too, that we don't want to have just one thing, but really be aware that there is no one right way. And if I offer something and you think that doesn't work for me, then find something else that does. right? And remember that there are many, many right ways to flourishing and growing. I've already mentioned this idea of just take yourself where you are. It doesn't matter what you have done or didn't do. It doesn't matter if you haven't been good at self-care up to this point, or if you're terrific at self-care at this point. You know, self-care is really an ebbing and flowing. It's moving just like our lives are and just like we are. So really start from where you are today. Keep in mind, of course, this is not about perfection. And as we talked last time, you know, perfectionism actually can be harmful to self-care and harmful to our well-being. So we don't want to allow ourselves to sort of step into that mindset either. And I do want to encourage all of us to really, you know, give yourself permission today to enter into this, to really think about in an honest way, where am I at with my own self-care? You know, we talked a lot in part one about why self-care is so important. And so I'm not going to repeat that now. If you didn't see part one, you know, I encourage you to watch it. But I really want today, ideally, if possible, to invite you to give yourself permission to look at where you're at. And we're going to talk more about ways to do this, but to really step into this as this is very important. And this may also be a new way of possibly changing your life and the lives of all of us as well. Quick reminder too, don't compare yourself to others. This is another trap that we pretty easily fall into, in part because of our culture and society and upbringings and all of that, but really don't. And also keep in mind, even if you're tempted to like, oh, so-and-so, they've got all their, you know, they've got this down pat, they know what to do, they're doing fine. Remember that it isn't always as it seems, you know, and even people who appear to have all their stuff together and doing great, not all, sometimes they're not doing as well as we think they are. So it really isn't about self-comparison. It's really about looking at ourselves and seeing where we're at and what we can do if we can do something to do better or increase our well-being. And the last thing is really, I hope and invite you to commit to taking action. As I said, we're gonna go through a lot of material today. Hopefully there will be things that sort of pique your interest or make you curious or that you think, I want to do some of that. I encourage you to follow that, but however it turns out for you, I really hope you will commit to taking some kind of action with respect to your own self-care. Because all of us need this. You know, as we talked last week or 2 weeks ago, that Norcross and Van den Bos quote that, you know, self-care is a human requisite. So yes, it's also a clinical necessity and it's an ethical imperative for those of us in the mental health field, but it's a human requisite. We all need this as human beings. Okay. So I do want to, just for a moment, we did talk about the broader continuum concept last time, and I'm not going to go into details about this, but I wanted to sort of just remind you of the continuum so that you have this here. And this is the broader continuum concept that's sort of building both on the stress-distress continuum put out by APA and also work of at all from envisioning that positive side of the continuum. So if this is the continuum, and again, I still think we need more on that left side, but that's to be worked on. I want you to think about then in terms of your own plan, and maybe, you know, take some notes here, jot this down, spend just a moment to reflect. But where along that continuum are you presently? And really be honest with yourself, and I'll pop it back up for you. Are you in that place of flourishing? Like, are you really on that far left side? Are you in the middle? Are you feeling significant stress? Are you moving into either distress or impairment? Are you possibly at the very end? Or maybe you're engaging in improper behavior. And remember, this is a continuum, right? It's not black and white in between these categories, but really be honest about where you currently are. And also take a moment just as you reflect to think about what's currently working well for you in your self-care routine. Are there things that are really working very well? And what is it that might need strengthening? You know, are there things you're doing that you think, you know, this is sort of working, but if I tweaked it, it might work better for me? So you know, what are those things that in fact would need strengthening? And the last one, what needs creating? And these last couple of questions, you may not know the answers to them, right? You might discover them as we go through some of the material today, but this is sort of how you can start to think about designing your own plan, right? And so I want you really to be pondering these questions as we go along. Okay. So then, barriers to effective self-care. And here, before we go into the material, I do want to invite you, we're going to do a poll, the first of our polls. And you should be able to see it now. It should have come up. If you look on your screen, you'll see I think it's down at the bottom for your screen. It says polling. You can just click on that. Please go ahead and just enter your answers. I'm going to give you guys just a little bit. We'll be able to see the results in real time here in a minute. And the question, as you can see, is what is your primary barrier to effective self-care? There's a couple of different options. I don't have enough time. I don't know self-care strategies that work for me, or I don't know what I really need. Also, I'm doing pretty good and don't need self-care right now. I feel guilty, or that I'm being selfish, or the pressures and constraints of the pandemic disallow my use of my typical self-care methods, or something else. Great, so the answers are still coming in. I'm going to give you about 30 more seconds. Just a few more seconds, and then I'm going to go ahead and end the poll so we can look at the. All right, so you should hopefully there be able to see the results. If you notice, the number one that came in is I don't have enough time, right? And that's doesn't surprise me at all, but fully 32% of us say I don't have enough time. The second one then is the one regarding pressures in the pandemic, disallowing use of our typical self-care methods. Yeah, it's been an intense year, right? And I think it's made it, you know, we, in addition to having to, as they say, pivot all of our practices, you know, in some ways we're having to really flex and change our self-care strategies as well in order to accommodate for that. So, okay, great. Thank you for your responses to that. So let's take a look and see then what the literature says are some of the barriers to effective self-care. One is this idea of the myth of invulnerability. And this is really that idea that we as therapists aren't really vulnerable, right? And of course, that's a complete myth, because yes, we're therapists and we're very highly trained and hopefully very highly skilled, but we are also human beings, right? And as human beings, we're vulnerable. And as we saw last week, it is exactly that vulnerability that becomes so important, and why we really have to pay attention to this in our work. And we have to really acknowledge that, yes, we too are potentially vulnerable. And not potentially, we're all vulnerable at different moments. And certainly I think during the pandemic, in some ways, our own vulnerabilities have increased, because, you know, many of us have been experiencing the same things right alongside our clients. You know, some of us have experienced death and loss, you know, we're working from home, right? Our vulnerability has increased. If we don't allow ourselves to recognize that, we put ourselves and our clients at greater risk. Also then is this idea that our training insulates us from risk, that somehow by virtue of being highly trained and knowing about self-care and knowing about psychological concepts, that somehow that's an insulating factor, which again is also a myth, because it isn't. Wouldn't that be nice? Denial is another huge barrier, right? If we don't, and we are going to talk some about the importance of self-monitoring and self-reflection and assessment later on, but if we don't even let ourselves see that you know, stress or distress or those kinds of things are impacting us, then we certainly can't do anything to make changes to prevent that. So denial will certainly be a barrier. Lack of awareness of our needs is related, you know, and I do have people ask this. It kind of sort of shows up in two ways. One, you know, it's where as clinicians, we might think, you know, I'm really fine. Not a big deal. Yeah, there's a little stress, but I'm doing okay. And sometimes that is true. Sometimes we are doing okay. But other times it's just that we've gotten so habituated to a chronic level of stress that we may not even know that we're practicing at that chronic level, and we may not be fully aware of what we really need. And sometimes it's not until we hit that place of crashing and burning where we're like, whoa, that I should have been tuning into this well before now. So paying attention to that is important. Also then is the mistaken belief, and this is big, but the mistaken belief that self-care is somehow narcissistic, self-indulgent, or selfish, which of course is the opposite. Some of this I think is cultural for sure, you know, and it's interesting, even when I talk with clinicians in a bunch of different settings, you know, and I say, you know, self-care is important, sometimes there's a real hesitance, there's a real sort of resistance to talking about us caring for ourselves, you know, that we should focus on caring for our clients, which of course we should focus on that, but that doesn't mean that we can't also and shouldn't also focus on ourselves. And so I think we both individually and as a profession really need to work and make an effort to fight and combat this sort of idea that self-care is selfish or self-indulgent in some way. Also, there can be the belief that self-care is some kind of a weakness, you know, that if we admit our vulnerability, we're admitting to some kind of weakness, which is not true, right? And in many ways, admitting our vulnerabilities takes great strength and courage. And then of course, guilt as well. I feel guilty if I'm saying yes to me, because that oftentimes can mean I'm saying no to someone else, you know, that kind of mentality. And that can be a battle for some of us. A couple other barriers that show up in the literature. One is that we don't know how to effectively care for ourselves. And I do see this, you know, I have clinicians who say, you know, I don't know what it is I need, and I don't know how to sort of help myself with that, whatever that might be. And so, you know, in some of this in the literature, it's been talked about too, that we don't really get trained in self-care when we were in grad school. Many of us don't. Hopefully that is changing now. And if it isn't, then we need to make it change. You know, we need to step up our efforts in that regard. Also, then, oh, and I'm sorry, this might be on there twice already, but that our training insulates us from risk. That we are not taught to prioritize and attend to self-care and training, as we already talked about that. I just mentioned that. And lack of time, right? This came up in Norcross and Vanden Boss's work as well. And this was the big one for us today in this group, right? In terms of that poll. And that's in part why we're gonna fit in some of these short little things as we go, because I do want to really sort of hit home the message that self-care doesn't have to take tremendous amounts of time. So yes, it will take some time, you know, we do need to exercise, we do need to eat good food, you know, but that doesn't mean that every day we have to have an hour of meditation and an hour of exercise and an hour of cooking, and, you know, because none of us have the time for that. But it doesn't mean that we can't also effectively and adequately nourish and attend to ourselves, because we can actually, and this is one of the things I really hope to share today, is that we can, in very small moments, very short moments, regularly throughout the day and weeks and months, we can fit in these little pieces of self-care, which can be extremely nourishing and revitalizing. And so we'll talk about that as we go through. Over-identification with role function is another barrier. That's where we're just really focused on, my job is here to care for my clients, for my patients, and we sort of can't get out of that we just get stuck in, I'm here to help them and they have to be my complete and 100% focus. We get sort of trapped in that. And of course, it is important that we are there to help and do those roles. And yet, if that gets too unbalanced, if we lean too far in that place of other care without an equal balance of our own self-care, that is exactly when we land in difficulty. Oftentimes difficulty that can lead to board complaints and real potentially problematic and harmful behavior with clients. So we definitely want to watch ourselves for that. Also, this idea of focusing on problems rather than prevention. There's lots of talk in the literature, and certainly it's my own opinion, that ideally we don't want to simply be focusing on avoiding burnout or avoiding compassion fatigue or vicarious traumatization. We want to be right back to that continuum. We want to be focusing on thriving and flourishing. Yes, we need to be aware of what are the symptoms of burnout and those kinds of things so we can catch ourselves early on. And that's in part, why we spent so much time on that in part one. But it can be a barrier if we're only looking at the problems, in part because then we're only starting self-care when when we find ourselves, say, in a place of burnout or compassion fatigue. And ideally, we don't want to wait nearly that long, right? We want to start now, even when we're flourishing, right? Even when we are in a good place, solid, flourishing, thriving, revitalized place. We still want to be tending to self-care, even in that position. And then the last one here is wishful thinking and self-blame. And what's interesting here is that these are not only seen to be barriers to effective self-care, but they are reliably associated with ineffective self-care. So not just getting it away, but actually causing problems for us. The wishful thinking is sort of that idea of like, oh, well, I'll get to it tomorrow, or I know it'll get better later, just sort of hoping that it's going to get better. That can be a real problem. And then also the self-blame. I mentioned self-judgment and self-criticism earlier. But when we get too deep in that, both of those not only can get in our way, but they actually can make it worse. So one of the things, and I know we talked a little about this last time too, but is that, personal therapy can be, and we're going to talk later, that can be one of the strategies for self-care for us as professionals. It can be very nourishing, it can be very enriching, and yet, as we talked before, and we're going to see, there are multiple studies that show that sometimes mental health professionals are resistant to seeking treatment for themselves. So even though it is what we do, we can be hesitant to seek therapy for ourselves. And there's a group of reasons that sort of have shown up again and again as the rationale for that. And so one of them is the idea of confidentiality concerns, that we work in this field, will others find out? Well, who will know? That kind of thing. Also a concern about financial expense, because for various reasons, and I think especially now in the pandemic, sometimes the financial piece is harder for folks. Exposure fears, this is related to, that idea, and there is some real fear and sometimes stigma here too in our. But if I, as a clinician, go and see a therapist, if they think I'm impaired, are they going to call and report me to the licensing board? Those kinds of things, this real fear of exposure and maybe negative repercussions. And just a desire for self-sufficiency, that independent streak. I can do this on my own, I don't need assistance. Time constraints shows up again, right? So we're seeing that come up again and again. And this one too, that is difficulty locating a good enough therapist outside our social or professional network. And so that's a big one. And Burse et al. Also did a study in 2013 looking at some of this, and you'll see some overlap. They they found in their research that in fact psychotherapists seek therapy basically for the same reasons as everybody else, right? Because again, we're human, so we are experiencing the same issues as others. And they found that many are willing to seek care, but, and this is concerning, fully 59% of practitioners in their study said that they did not seek therapy even when they knew it would benefit them. And I think that is concerning for us as a field, right? And they, in their study, the greatest obstacles, and this is what mirrors Norcross and Van den Bos's work too, was difficulty finding an acceptable therapist and lack of time. So both of those are the two that seem to be the biggest barriers to clinicians actually pursuing treatment for themselves, even when they know that they could be really helpful. Okay. So I want to just review again. We spent a lot of time on some of this stuff last time, and I'm not going to go back through any of that, but I do want to just remind ourselves of some of the things that can be really toxic or difficult. And this is from Scoville and Trotter Matheson's, they listed as their poor self-care deadly dozen. And I suspect you will recognize some of these as we go through. But one is toxic, having a toxic supervisor and or a colleague support. You know, so if we don't have good connections and support, having very little fun. And we're going to talk some about play and how that play and humor and how those can be associated with good well-being. But lives with limited fun in life or work, more likely going to lead to burnout. Also, having only a fuzzy and unarticulated understanding of one's own needs. And so we see this come up again and again too. And it is out there. And I think especially, as I said before, when we get in that state of sort of chronic stress and we're just living with it, we don't even realize that we're in it. If we're not in the habit of checking in with ourselves, sometimes we lose the ability to do so. So we get sort of more out of touch. And I know all of us as clinicians know this, but it does happen. And so this fuzzy sense, is certainly very problematic for our own self-care and honestly for our work with clients too. No professional development process that turns experiences into more competence and less anxiety. And we'll see how this sort of professional developmental process is really important, that we have to keep finding ways to grow as clinicians, and I would argue grow as people, as humans, but where we are increasing and continuing to build and strengthen our competence and decrease any anxieties that we may have. That becomes really important. Also, just not having an energy-giving personal life, that if our life becomes way too much about work, and or what we do have in our personal lives is sort of shrinking or shriveling, that is really going to impact us. And also an inability to know reasonable requests. And we'll see this come up again and again too, right? Boundaries are so very important. If we find ourselves not able to say no, that's going to start to have an impact on us, a negative impact. And I will say, I do see this. I hear a lot of clinicians now, in part because the need is so great, during the pandemic and with all of the stuff that we've been facing as a country with social unrest and political division. There's a great deal of need right now for our services. And so I hear clinicians saying like, oh, my caseload is full, but I just feel like I have to take them. I can't say no. And that kind of mindset, maybe we can do it once, maybe twice, but if that's our consistent mindset, we are definitely going to run ourselves into the ground and quite possibly going to be doing harm with our clients. And so I think we really do have to pay attention to that. Okay, a couple more then. One is that vicarious traumatization takes an accumulated toll on us, especially if it can, keeps happening and we're not doing things to protect ourselves or get ourselves assistance with that. Also, when personal relationships are predominantly one-way caring relationships and we are the giver. This again, back when if we're solely focusing on giving, and we never tune in to receive, that's going to be land us in a difficult place. Constant perfectionism in work tasks, as we know, and as I mentioned before, perfectionism is sort of the death knell to good self-care. Continual unresolved and ambiguous professional losses. And this gets back, remember last time we talked about that cycle of caring. And one of the things that can sort of, as Scoville and Trotter Matheson talk about, sort of pierce the caring self, is all of these unresolved and ambiguous professional losses, which we do experience in our field. You know, sometimes clients just don't come back. We don't know what happened. So there's all sorts of ambiguous loss that we experience. And if we're not really making efforts to tend to our needs around that, it can really have a sort of crushing impact on us over time. Another poor self-care deadly dozen is the strong need to be needed. We do need to sort of monitor ourselves for this. You know, I think a lot of us got into the field in part because we want to give, but also there is some satisfaction in being needed. But if that is what's leading, then that can put both us and the folks we're working with in potentially compromised positions. And then a professional success defined solely by the client, student, or patient's or appreciation, meaning that if we're judging our professional success on whether or not our clients get better or whether or not our students do great, if that is our only measure of success, then that is going to weigh heavily, because we don't always have a lot of control over that. You know, we can do terrific and incredible work and someone may still not get better. Someone may choose to not do what we recommend. But that isn't necessarily on us. You know, there are cases that we can't, that are going to be outside of our control. And so we need to broaden our definition of success. Okay. So pausing for a moment, think about designing your own plan. And the questions here would be, what barriers might be impeding your own self-care? You can certainly think of the ones that we just covered. Maybe there are others, you know, that you know to be your own personal barriers. So what are they, first of all? And then what are a couple of actions that you can take to address one or more of them? You know, if there's a lot of barriers, maybe pick just one. But really thinking about how can I sort of either get out of my own way or help to sort of tear down one of these barriers, to open up some room for better self-care. And then also, what of any of those in the poor self-care deadly dozen do you see in yourself? Can you see any? What are the top 3 for you? And, you know, this gets back to what we talked about last time too, that we need to know what's affecting us, right? We need to know the things that are weighing on us so that we know how to address them. Okay. So we're going to pause again for a moment before we dive into lived self-care and just take another fairly quick break for a little exercise on loving kindness for clinicians. So on this, if you'll just close your eyes and take a few deep breaths. As you do, I'm going to slowly just read some phrases. And I want you just to, as you continue breathing, just hold your attention on the words and their impact on you. And just return gently to my words. If your mind drifts, that's fine too. And just keep breathing deeply. May I be able to care for and nurture myself so I can attend to the needs of others with generosity, balance, and presence. May I develop equanimity and let go of expectations of healing, fixing, or curing others. May I see my clients with a freshness of mind and an openness of heart. While I care about their pain and suffering, I cannot make choices for or control my clients' lives. May I accept the limitations of others with warmth and compassion. And may I accept my own limitations with the same kindness. May I see, hear, and know my clients in their wholeness and beauty, not just in their suffering and the pain they bring to my office. May I see the goodness, intelligence, and vulnerability in my clients today. May I let this moment be not as I want it to be. And take your final deep breath. And then we will move on. And as we go, you can take notes for yourself. These little exercises, do they help you? Do they not help you? Be mindful of your own experiences as we go. So moving then into this concept of self-care, of lived self-care. And before we dive into that explicitly, I want to just review too, what is self-care? What do we mean when I'm saying self-care? What is it that I'm referring to? So a couple of things that define this. One is there's self-initiated practices. We're going to talk a lot about the practice of self-care today, of taking an active role. It does require real active efforts in protecting our own well-being and happiness. It's attending to ourselves and also this getting to know ourselves, right? So we're back to that self-reflecting, self-monitoring. There's a quality of being aware, as we've talked about, and also really honoring our needs. So it's not just knowing what we need, it's then really responding to and honoring that. So being aware of what it is and then making sure that we get it. And we may not be able to honor right now in this moment. If you take a nap. Hopefully you won't be doing that in the middle of the webinar, but maybe right after you can get a 20-minute nap or something. It's both being aware and honoring. Also mindfully paying attention. So there's that kind of quality of mindfulness, and there's a deliberate acting. So it's very deliberate and intentional. And we promote our well-being in multiple directions, right? Physical, mental, emotional, psychological, and spiritual. Also then, effective self-care is of course personal and individualized. As I said before, what works for you is probably going to be different than what works for me, and vice versa. Self-care is by definition replenishing and nourishing. And this is really important because it can distinguish it sometimes from anything else. If you're doing something and you're telling yourself it's self-care, and yet you're not feeling replenished or nourished, then you might want to rethink that. You might want to ask yourself, is this really working for me? Now, that doesn't mean that you're going to love everything that you do for the purposes of self-care, right? Sometimes we do have to do stuff we don't really like, so there are mornings I get up and I don't feel like exercising. I'd rather not, and yet I do it anyhow. But I do it because I know that in the long run, that is going to lead to being replenished and nourished, right? It's of course deliberate and self-directed, sustainable and holistic, and integrated into our daily lives. And that's what we're going to talk more about in a moment. Good self-care is also comprehensive and flexible. And I think, we're going to talk about that when we talk about strategies, but also that's been so important right now in the pandemic, right? Especially that idea of flexibility, because some of the things we did before, we haven't been able to do now. For those of us who used to go to the gym, that hasn't always been an option during the pandemic. And then it's characterized by a complex pattern of strategies. And we're going to talk more about that in just a few minutes. So what is lived self-care? Before we get to that, I want to talk about what it is not. This is not self-care where you sort of put an item on the to-do list, which is what self-care often feels like, Also, we see signs on the internet or various places where it's like, oh, today's self-care day, or I'm going to, go get a massage or a bath. Those may be self-care items, but that in and of itself is not self-care. And having a self-care day, well, maybe that's a good idea, but self-care really should be every day. So self-care is not something on the to-do list. It's much more profound than that, actually. It's also not something like a checklist that we complete and throw away, that, oh, I did that today, so I'm all done. It's really an ongoing practice, as we'll talk about. And it's also not something that we just do here and there. In contrast, lived self-care that is lived, that is an ongoing living thing in us, is really an integrated way of living. And it's fully integrated. It is woven into our life. It's an ongoing practice and a habit. So it's not a one time and done. It's not a 2 times and done. It really is, what do I need now? And how can I give that to myself? And then 10 minutes from now, what do I need now? Right? So it really is this practice. And it's a daily and moment by moment choice. And this in some ways, I think, can feel heavy to some. And yet I also think it's what's so freeing, because we at the moment have the option of choosing something that serves our self-care, that serves our revitalization and nourishment, even in the midst of very trying, challenging times like now. So I think remembering that is really important. Good self-care doesn't mean that we're always going to be happy. It doesn't always mean that, we're never going to face adversity, as we're going to talk more about in the resilience section. But it does mean that we can take care of ourselves in the face of that. As I mentioned, lived self-care then is woven into the fabric of our life. It's literally in our lives. You can't separate it out. It's a kind of active attending to our needs and actively resourcing ourselves. And this is both internal resources, in terms of our own thoughts and how we manage our own self-critic and those kinds of things. And it's externally resourcing ourselves. Do we have office support for our practice? Do we have colleagues we can lean on and reach out to? So it's both. And then in Johnson et al.'s article, and we're going to talk about this in a few minutes, Norcross also talks about this, but this gap between knowing about self-care and actually practicing it requires our own effort, right? As well as what they called embedding ourselves in a caring community. So, I think for all of us, we probably are aware that there is that gap between, yeah, I know about self-care, but am I living it? Am I doing it? Is it integrated into my life? We can help to shrink that gap through our own efforts, and we're going to talk about some of that in a moment, but also through this idea of embedding ourselves in a caring community. Okay, let's see. So I was just checking the time. Actually, we'll do that when we come back, but let me move on then to the designing your plan before we take a quick break. We're going to take a break, 2 breaks during this. I forgot to mention that in the beginning. So designing your plan, how much of a priority is self-care in your daily life? Now, again, no judgment, just honest reflection. How much do you really prioritize self-care? Or in trust? How much are you like, well, I know I should exercise, but I'll do it tomorrow. Or I know I should meditate, but I'll get to that later. I got to get to these emails first. So what is your priority? And getting real with ourselves about that is very important. Is self-care for you integrated into your life? Or is it sort of, these moments that you almost step outside of your life and you do this self-care thing and then you come back? How integrated is it for you? Is it something on your list of things you hope to get to in the future? Something you do now, or somewhere in between? And before we take our break, I'm going to open another poll for you all. So you'll see it on your screen. The question is, how often do you practice self-care? And again, be honest here. All of these, by the way, I should mention, this is all anonymous. No one sees your name. So really be honest about how often you're practicing the self-care. So 0 to 24% of time, 25 to 50, or 49% of the time, 50 to 74, and 75 to 100. Give you about 15 more seconds. All right. And these are the results. So of all of us here, and it looks like we have nearly 2,000 clinicians here. The most of us, 33%, are doing between 25 and 49% of the time. The second highest is 50 to 74. So on the whole, we're doing good. But I also think, right, that shows room for improvement. Ideally, if we want to be more on that side of the continuum where it talks about flourishing, then we're going to be more in that 75 to 100% of the time. Because what happens there, and it's when you start to really practice this and do it, when self-care becomes lived, meaning that it's that lived integrated experience, it's not something you have to do. It's something you automatically, like we don't tell ourselves, well, I'm put that on to do, check it off. We just do it. We do it naturally. Our bodies do it. And once you start sort of practicing self-care, it will become that same thing. It will become so ingrained in who you are and in your life that it will happen. You'll be more in these top two categories for sure. And one of the key things, and we're going to talk about this when we get back, is that it's not just what we do for ourselves, but self-care is both, as it says in the title, turning toward ourselves and turning toward others. In terms of, we're talking about the necessity and limitations of self-assessment. So as we talked last time, right, essentials for self-care include self-awareness, self-assessment, and self-monitoring, right? These are all absolutely critical for effective self-care. And, self-awareness, right, includes both the capacity to notice and to address, as we talked before, our own needs, and really to be able to do so as generously as we do with others. Self-assessment, then, we're going to talk, before we move on to self-assessment, we'll talk a little bit here about self-awareness. And there's so much on this in the literature, I can't possibly fit all of it in here, but there are, as we know, and this will make sense to all of us as clinicians, it has been linked with many benefits sort of across the board. One is, good self-awareness can help us to manage our countertransference reactions during sessions. It can also increase our interpersonal engagement with clients, as we're in the session. The more aware we are of what's happening for us, it actually has been shown to increase that interpersonal engagement, which of course is allows in many instances for effective care. It also then, of course, allows us as clinicians to be more aware of our own biases and stereotypes. And so, we can be more mindful of what our own limitations might be in our work. And there are multiple studies. Many of them are discussed in the Rokach and Bolzareg article that show that we as psychologists identify self-awareness as a valuable means of preventing burnout. In addition, there's a study by Rupert and Kent in 2007 of 595 psychologists where maintaining self-awareness was the second highest ranked career sustaining behavior. So, we can see that self-awareness is critical to both our work and to our ability to tend to ourselves. Self-assessment, I get a lot, and have gotten even in the last webinar, a lot of questions on, well, how do we go about assessing ourselves? Are there tools that we can use? And the answer is yes, there are tools that we can use. One is the ProQual, stands for Professional Quality of Life. There's been a lot of research done on this. It's a standard measurement. It was developed by Beth Hudnall Stam. She's at the University of Idaho. And I think the latest revision was in 2005. It has 3 different subscales, total of 30 items, and research has shown it to be reliable and effective in measuring both positive and negative effects of caring for others. It is available for free at that site that I gave you right there on your slides. And that picture is actually from the website. So you can go and get the actual instrument there and you'd make use of it. And again, it is free. A couple other options for self-assessment, and there's a lot of different rating tools out there. Another one then is the Connor-Davidson Resilience Scale. And this in some ways focuses on resilience, but is also a good way to sort of assess oneself. And there is a lot of, in some ways, some similarities between that and the ProQual. And then also the Scovolt Practitioner Professional Resiliency and Self-Care Inventory. And this one has 4 subscales, really looking on the one hand at both professional and personal vitality, and then also looking at professional and personal stress, and ranking that on a scale of 1 to 5. So each of those would be some really good, if you're looking for a tool to do self-assessment on, that would be a good tool. Okay, so I'm just gonna go ahead and put all these up. What are some of the limitations then if we're doing self-assessment, right? Because on the one hand, self-assessment is critical and important. On the other hand, it's a problem because we know in research, a lot of research has shown us that there is this inherent fallibility in our own self-assessment, that our self-assessments are notably inaccurate. And part of this is because perhaps related to the superiority bias, right? And in McCormick's study in 1986, he did a study where he was looking at they did a study looking at 189 drivers who were surveyed, and they were asked to rate their comparative driving skills. How good were they? Average, above average, et cetera. And fully 80% said they were above average. Now, all of us who know statistics knows that that is really not likely to be true. And so these were drivers, right? We could then ask the question, well, maybe that data doesn't really apply to highly trained clinicians, right? Well, the answer is no. It turns out that it probably does. If we look at the Wallfish study from Wallfish et al. From 2012, 129 mental health professionals were surveyed. None of the participants rated their skills as below average. The 75th percentile was the modal rating, and fully 25% rated their skills at the 90th percentile or above. So the take-home message then is that we, even as highly trained clinicians, are very likely to overestimate our skills and competencies, just like everybody else. But unlike everybody else, when we overestimate them, it can have potentially a very serious impact on our clients and on our work. There is also then this idea of the self-serving bias, where we as clinicians can be prone to attributing our poor performance to things like bad luck or uncontrollable circumstances. We may say, oh, well, I made that mistake or I did this not because of a problem in my own competence or my own vulnerability, but because, that was just a fleeting circumstance, or that issue, it's not really a big deal. And so we can overlook those kinds of issues. Also is this concept of illusory optimism, sort of this idea that we might be immune to misfortune. And again, related to some of the stuff we talked about earlier, sort of that idea that we even can, this illusory optimism can undermine our ability to really acknowledge and appreciate that we are in fact vulnerable to decreases in competence, especially during times of higher stress. Also then is a failure to recognize problems with our own competence. The failure to do so is most pronounced for individuals who are the least competent. That was a finding by Kruger and Dunning. And so those whose competence is most compromised may actually be the least able to be aware of the problem or to respond appropriately to it, right? So you can see how this makes self-assessment very problematic. Also then, competence is context specific and vulnerable to decrements when we are experiencing distress. So when personal distress or illness or cognitive decline or something like that places our competence at risk, it may be in many respects both unreasonable and illogical to expect that we as the individual would then also be able to accurately predict adverse effects of those events, or to really recognize how much it might be impacting our functioning, much less be able then to establish and create some way to help ourselves with that or to get out of the situation. So what then would be the solution, right? And Johnson et al. In their article on communities and competence proposed that we move to this model of communitarianism, which in many respects recognizes both the individual and the social, that it's a both and, and they talk about it there as coming from sort of the African philosophy of Ubuntu. I'm not sure if I'm pronouncing that right, but the idea of I am what I am because of who we all are. And critically, this is what's very important for us, that both the individual and communities then have ethical responsibilities, that it's not only the individual. And then in this context, competence then becomes not just an individual obligation, but also a collective, kind of a collective moral duty, right? So it also means that we then start to think in terms of competent psychologists and competent communities. And that we start thinking in the sort of mindset that we're accountable both for our own personal well-being and for the professional competence of our colleagues. And that we're in part then, right, you can start to see how this sets up where we really start to share this concern for the common good. So myself as a clinician, I'm not just worried about me and my own clients, but I'm worried about you and your clients, and I'm worried about the field in general, right? All of us as practitioners. So we really start to have a mindset of it's not just so focused on the individual and this community mindset. And they talked in this, Johnson and Jeffrey Barnett was also one of the authors, and there's a couple other authors. They went so far as to even propose a reformulation of the ethics code based on this idea of communitarianism. And so, for example, they said, now this, by the way, let me just be very clear, this is not our current ethics code, but this is the reformulation that they proposed, that they think would be better, would be an improvement. And the italicized sections here are what they proposed, so that in standard 2.03 regarding our maintaining competence, they would add the sentence that psychologists maintain regular engagement with colleagues, consultation groups, and professional organizations, and routinely solicit feedback from these sources regarding the competence for work in specific roles and with specific populations. So that they very firmly feel that this should be built right into the ethics code. In addition, then they would add a section C to standard 2.06 that says, when psychologists become aware that a psychologist colleague is experiencing problems that may lead to interference with professional competence, they offer care and support and collaborate with that colleague in assessing competence and determining the need to limit, suspend, or terminate their work-related duties. So you can see from this mindset, if we're starting to focus more on the community, right, that yes, we're paying attention to ourselves, but we're also paying attention to our colleagues, and not paying attention in a way of, oh, that colleague's doing something wrong, I'm going to get them in trouble. Not that, but paying attention in a way of, hey, I know what that's like. Are you doing okay? Is there some way I can support you? Let's talk about this. And if I'm the one struggling, then hey, can you support me? You know, that we really are in this together. It's really, as the title of this webinar series talks about, right? It's turning both towards ourselves and towards each other. And Johnson and et al. Talk about these as, they said that we should develop these competence constellations. That's their phrase for them. And they define it as, quote, this is a direct quote from their article, a competence constellation is a psychologist network or consortium of individual colleagues, consultation groups, supervisors, and professional association involvements that is deliberately constructed to ensure ongoing multi-source enhancement and assessment of competence. So the whole point of having one of these competence constellations then is in part to balance all those limitations on our own self-assessment, so that we do have colleagues who know us well enough to be able to say, hey, Liesel, it looks like you're a little off. Are you doing okay? Is there some way I can help? You know, they can catch us. Also, this is really important because we as human beings have our own blind spots. And sometimes we just can't see what we can't see, but our colleagues may see it. And if we really form these competence constellations, which are very collegial, again, it's not about getting people in trouble, but it is also about stepping up and being willing to say something to one of our colleagues in our competence constellations if we see them struggling, or if we think that they're in a state of distress or impairment, and certainly if we think they're in that far into the continuum where there's some kind of improper behavior going on, you know, but it's a collegial, let's support each other in assessing each other and in assessing our own competence. The composition and quality of the constellations are important. Of course, these need to be people who we can trust, people who, you know, both know us and know us well enough to know sort of when we're maybe not ourselves. And also people who, though, are going to be honest with us. You know, there might be a lot of people who know us, but wouldn't be willing to say, hey, I think you're off there. You know, the way you're talking about that doesn't sound like how you would normally talk about it. What's going on for you? Again, not in an accusatory tone, but in a, do you see that? And let's work on that, you know. Also, in terms of who's in it, they, you know, certainly colleagues, peers, supervisors, mentors, and also our own personal therapist could be in our competence constellation. You know, because again, personal therapy is a way it's not only very nourishing, but it can be enriching. It grows us as the therapist. And so having that person also as a part of our competence constellation can be really helpful. And there's both this sort of emotional support that is offered, you know, but also, again, someone else's eyes looking at and talking with us about competence issues. Rokach and Bolazreg also talk about this as being, these competence constellations as being an effective way to improve self-care and to decrease burnout. And in part, that's because they allow for feedback without the fear of serious repercussions, because sometimes clinicians will say that the reason they don't share some of this stuff is because they're worried that, someone will report them to the board or that kind of thing. Someone will think they're impaired if they're experiencing distress. And so if we have a group where we feel safe to talk about this, it can really, really be helpful and effective. Also, it does allow, as I've mentioned, for that constructive criticism in a safe space. And it also gives us a place to talk about and share our own self-care strategies. And we can also help to deepen each other's self-care. And we can be creative with each other. There are benefits to the client when we do this, when we're engaged in this, in part because it allows, right, for those of you, it's a little similar to our, peer consultation groups. It's not only that, this concept is bigger, but we can get together with colleagues and help resolve difficulties in treatment, say if we're struggling with a high-risk patient or something. So, and again, it also can protect if we're aware of our blind spots, that's beneficial to our client. And of course, it benefits us as the clinician as well. So with the idea then back to designing your own plan and thinking about your specific self-care plan, do you have a competence constellation? Not just a peer consultation group, that might be part of a competence constellation, but it's also more because, in most peer consultation groups, yes, there's a lot of talk about cases and those kinds of things, but not so much really looking at each other's competence. Again, in a non-judgmental way. And that's really a way that we can help each other. If you do have a competence constellation, is the support there broad and deep? Is it deep enough? Do you need to add someone to your competence constellation? And by that, you may have lots of people in your competence constellation and they may not know each other, right? So if let's say you have a personal therapist who is a part of your competence constellation, that doesn't mean that they're going to be in a group with you. It just means that there's someone who's a part of your own constellation that you can turn to for these things. And if you don't have one, how can you create one? And who would you ask to come and be in it? So again, things for you to ponder. I'm going to take another pause here for a moment to do a short exercise on compassion for our self-doubt. And again, this also comes from the anti-burnout card deck by Warren Ablett and Willard. And so if you'll take a moment and just close your eyes, take a few deep breaths. We've all, of course, been in situations where we doubt our own expertise or where we feel helpless or overwhelmed or possibly even like we've failed. And you may pretty quickly think about experiences where you feel like you failed or you were overwhelmed. As you're breathing and with your eyes closed, I want you to bring to mind a mentor or a person who carries well wishes for you, who you just know really has your back and has your best interests at heart. If that person, if you're having trouble identifying someone, you can choose an animal or some other being, but someone that helps you feel safe and loved. And you might imagine this loving being or person or animal extending a sense of worth towards you. Possibly imagining a hand on your shoulder or being held in some way. Any form of connection. As you continue to breathe, I invite you to build on that image and invite in additional beings who have shown kindness to you in either big or small ways. You might imagine all of these beings connecting around you in a circle, sending love to you. Notice what you feel in your heart region, and allow your body to soften as the circle expands, knowing that you are being held in love and compassion. Take a few more deep breaths. You can start to come back to the present. And that's another good example of just a really short tool that we can use, right? Again, these are taking just a couple of moments. But, you know, imagine when we're in those experiences of self-doubt, or when we've just had a very bad session with a client, and we walk out of that session and now we're heading into another one. We can take a few moments, you know, to just sit and do an exercise like this, bringing in compassion for our own self-doubt, for our own experiences, bringing to mind people who are supporting us, and letting that, as we're going to talk more in the later part on resilience and strategies, but if we let that into our bodies, that actually can help sort of calm down that activation that happens that keeps us in burnout or keeps us in distress, or leads certainly to things like compassion fatigue and vicarious traumatization. So some of this is calming the body, and I'm hoping that many of you are having the experience when we take these brief moments that a lot of these actually, yes, they calm the mind, but they're also physiologically calming to the body. And this is a way of providing ourselves real nourishment and support. These are self-care tools that we can use day in and day out on moment-to-moment basis. Okay. So moving in then to self-care strategies and techniques. And before we dive completely into that, I want you to, oh, I'm sorry, it does look like I didn't share the results of that last poll, but I will do so on this one. We're going to take our final poll of the day, and it is up. So the question is, how many self-care methods do you utilize regularly? So, and really regularly. So think of it as like on the norm, on the average, how many self-care methods do you use? You guys have been terrific about responding, by the way. Thank you. It's really great to be able to see your input. I think both for me and for all of your colleagues too. So thank you for your responsiveness. We give it about another 20 seconds. If there's any others that want to jump in. Great. So there are the results. You should be able to see them now. The vast majority, 53%, have between 4 and 8 self-care methods, which is pretty good. You'll see the bulk of it, though, between that and the 0 to 3, right? 0 to 3 has 38. So almost 90%, or just over 90%, have 0 to 8. Certainly 4 to 8 is pretty good. You'll see as we go that if we can bump that up, that would be even better. And I mean that, by the way, bumping it up and being better in terms of increasing our well-being, not in terms of, oh, we're not doing enough. So be careful that that self-critic and self-judgment doesn't come in when we talk about this. Okay, so self-care strategies and techniques. Couple things to keep in mind. There are thousands of techniques Clearly, I'm not going to go into all of them today. Instead, I'm going to focus primarily on strategies for restoration and sustainability. These strategies are multifaceted. And the reason I'm focusing on the strategies rather than the specific techniques are twofold, but primarily because the research, and a lot of this research has been done by Norcross and Van den Bos, but a lot of the research supports that having multiple broad strategies is really what leads to greater increased well-being, that we want to focus on the broad strategies as opposed to little tiny specific techniques. And if you think about it, that makes sense, right? It also, I mean, I can tell you, okay, you should meditate, or there are people who say, oh, go have a spa day or do this or that. Those are all techniques and they might be wonderful. Sometimes getting a massage is a really valuable thing to do. It might work for some people, it might not work for others. So the techniques are going to be very, very individualized and personally based. And you can have, and I hope you do, and I encourage you if you don't, to have many, many, many techniques and tools that you use. But the overall strategies I'm going to go through today, and within each of them, there's going to be lots of techniques that can come from that. And I'll mention some of them too. But the main take home here is that having just one particular skill in your arsenal of your self-care arsenal is less important than having a lot of different strategies that you can rely on and turn to. And if you think about it, right, that also helps with that comprehensiveness that we talked about and that flexibility. Because even if in the face of a pandemic, there are things we can't do, if we have many broad strategies that we've already built into our lives, you know, let's say we've got 10 of them and now we can't do 4 of them, we can at least turn to those other 6, right? So comprehensiveness and flexibility is important. Do keep in mind, this is not a one size fits all. I did just talk about strategies versus techniques. I'm not saying not to have techniques. We should all have techniques. Of course, we need them. I'm just going to focus on the strategies because I think that's more overarching. And I'm going to let you guys fill in the particular techniques within the strategies that work for you. And the research really is showing that self-care that is effective is characterized by having a complex differential pattern of different strategies. We're going to talk about that. And I also want you to keep in mind that self-care needs change over time. Certainly they change over the course of our career, and they even change, you know, they can change certainly during times of a pandemic, right? Our self-care needs now are probably very different. I'll certainly speak for myself to very different self-care needs now as it was prior to the pandemic. And keep in mind too, that they can even change over days or weeks. You know, we all are moving through life. We have periods of greater and lesser intensity. Maybe we have a big deadline coming up or whatever it might be. And, you know, it may be that in those weeks with increased stress or increased intensity, we actually need to increase our self-care tending, and we may need to use more of those strategies or techniques. So just be mindful that self-care is going to change over time. And ideally, we are going to flow with that and grow with that. Because as hopefully you're starting to see, self-care is also a lot about growth, personal growth and professional growth. The 4 dimensions, I want to just mention this here. We're not going to spend a great deal of time on it, but I think it's useful. This comes from Scoville and Trotter Matheson's work. And they describe these as the 4 dimensions of practitioner success. If you notice the top 2, the one on the left is client, student, patient, change, or appreciation. So focusing on that as a dimension of success. That is one where we have limited control. I think I spoke to this earlier, that yes, we do want to judge that. Of course, we want our patients to change and get better and or to appreciate the work that we're doing, but we don't want to solely judge our success on that basis because we're not, by and large, we're not in control of that. In the top right, then we have external recognition by supervisors and peers, which is another dimension on which we can judge our success. But again, we may not have a lot of control over that. Whereas the bottom 2, on the left, expert content knowledge, and on the right, practitioner's mastery of the working alliance, we as the practitioner have high control of both of those. And so it's if we're focusing only, as many of us do, on that top left category, if we're really deriving sort of our validation of our professional competence and self-worth from that dimension only, then, you know, we can end up in a place where we're judging ourselves on whether or not our efforts were useful. But again, that's the one where we have the least control. And as we're going to talk more about, you know, yes, we want to be mindful to those things, but we also really want to focus on areas where we do have control. And in this case, from this mindset and this model, it's those latter two, the bottom two things, right? Our professional expertise, what we know about our field, keeping up on the data and theories and techniques, excelling at, you know, acquiring knowledge in our field. And then, of course, the quality of our relationship with the others with whom we're working, be that clients or students, you know, that working alliance that we create, the very thing that facilitates good clinical work. And of course, it's also very important for effective risk management, that alliance. And so these are where we have control. So at the very least, we want to be focusing here as well. All right, so then what are the 13 broad strategies? These are broad strategies specifically laid out by Norcross and Vanden Bosch. And here I'm actually using their book. It's in your reference list. I'm going to go through the 13 broad strategies. You will see, if you're familiar with the literature, many of these are included in many other people's work. The reason I'm sort of going by this is because I think they've done a really great job of getting a lot of material into this very succinct sort of 13 strategies. I, of course, am not going to be able to cover everything in each of them, but I'm going to hit on some of the highlights. I want to give you the broad strategies so you have them. And I do highly recommend their book called Leaving It at the Office. Again, it's in your handouts and references if you want to learn more. They do also have in each chapter, they have a chapter on each of these strategies, and in each chapter, at the end of it, they have checklists, which are really helpful in terms of if you want another way of thinking about how do I sort of assess my self-care or those kinds of things. Those checklists are really, really wonderful, and they're very thorough. All right, so what are they? The first is this idea of valuing the person of the psychotherapist. This is really just valuing ourselves in many regards. And although one would hope that we don't need to be reminded of that, we actually do, because so often we are putting everyone else in front of us. And you know, then when we do, as we talked earlier, you know, we may experience a lot of guilt if we actually choose to turn around and pay attention or tend to our own needs. So this actually is really important, the idea of taking self-care seriously as a professional obligation. Now, I would also add as a personal obligation. And I know sometimes when I'm with colleagues or in leading seminars and things, and I say, well, we need to focus on our own self-care. Again, there's an immediate reaction of, well, we need to focus on clients. Yes, we do, but we need to do both. And I actually think we have to stop, all of us can take some responsibility from stopping that myth that it is narcissistic or self-indulgent or selfish to focus on ourselves too. We also then, of course, have to make the time for self-care. And I know this can be challenging, and partly it's like, well, what does that mean? Some of what I'm hoping to get across today is that making the time for self-care can actually, it's not like you have to schedule out 5 hours, you know, once a week. It's that you build it into little pockets of your life. You know, just like we've done these short little meditations, and there's so many more you can do, but here and there, you just build it in. And over time, you know, once each of these little 2 or 3 minutes here and there, that will add up over time. And even some of the other stuff that's harder to schedule, like, wow, where am I going to find half an hour today to do my exercise? Okay, we might need to skip it 1 day, 2 days, but if you're finding yourself really skipping exercising a lot, then I think we have to ask ourselves, you know, we do have to, at some point, there's going to be some choices here where we have to really say, you know what, I am not willing to sacrifice myself completely for somebody else. And so that's a place and all, a personal choice that we have to make, but I think we all have to get there at some point. Certainly this has to do with noticing, valuing, and responding to our own needs as generously as we do to the needs of others. If we could find a way to be as generous to ourselves as we are to the very people we're caring about, wow, we would be much, much more revitalized as a whole profession. And remember, for those of you who may be having that response of, wow, that's selfish, it's actually our revitalization that is going to also vitalize our clients. So it is reciprocal. It's not one or the other. And also under this strategy, then we make efforts to facilitate your own self-awareness and self-assessment. This is a little one piece which gets towards the technique part is then you put it in your calendar. And that doesn't mean you put, self-care, noon to 1. Maybe you do, but I would encourage you to get more specific about that. I mean, some of self-care is having connections with colleagues. So maybe once or twice a week, you actually do schedule in an hour with colleagues. Maybe that's right now via Zoom. Maybe when we can all get back to normal, maybe that's meeting up for coffee, but that yes, you actually put those times in your schedule. Maybe you do schedule out time on your calendar for meditation or exercise. Or for a transition between work and home life. So there's various sort of ways that you can do it, but really putting it in the calendar and then holding yourself to that as firmly as you would hold yourself to, a session with a patient. These are really commitments to yourself. And on the backside of that, commitments to your patient, because the more you are a healthy, vital person, strong in your own well-being, that is going to help your clients also. All right, 2, refocusing on the rewards. We talked a lot about this in part 1, so I'm not going to go into a great deal of detail here. It's really a balance, which we also talked about the hazards in part 1. So, but these are 2 of the strategies. One is refocusing on the rewards. The second is refocusing on the hazards. And it's a balance between the 2. We absolutely have to know what are the hazards in our field. And we covered that a lot in part 1. We have to know them. We have to know when they are impacting us. We also need to know the rewards. So many of us got into this for really good reasons, and there are amazing rewards in the work we do. It's very enriching work. But if we get so focused on the hazards, we might lose the rewards. So we need to pull those back into our focus as well, and always having a balance as best we can between these 2. 4th strategy, minding the body. And I know in some ways it's easy to say, well, you should exercise, you should eat right, you should get sleep. And yet, I'm going to say it anyhow, it's indispensable. It's absolutely indispensable. If we are overlooking our bodies, we are overlooking ourselves, period. And so much of the research, right, on mindfulness and a lot of it is about getting into our bodies. And in fact, some of the work by Adrian Gentry and Adrian Deitch, we're going to talk a little bit about some of that at the end. They say it's not mindfulness, it's bodyfulness, which I think is a great quote, because if our bodies are thriving, we are going to be thriving. And if we ignore our bodies for too long, it will not be long before we, will develop all sorts of medical issues, as we know. So sleep, exercise, nutritious food and hydration, and also many breaks throughout the day where you're moving. It's a lot of work now, especially in front of Zoom and in front of screens all day. But even when we're not doing that, a lot of us sit with clients all day, so really getting up and making an effort to move. That alone, those are small pieces of self-care, again, that you can fit in various places during your day. Pretty easy to fit in. All right. Number 5, the 5th broad strategy, nurturing relationships. So this would include things like our competence constellations, right? Which can ensure optimal functioning and help protect us from our blind spots, from not recognizing problems. They can also include peer consultation groups or clinical teams, or even sometimes doing co-therapy to keep ourselves sharp and vital, and collegial friendships. We also want to have relationships outside of work. And I think this is interesting to note that the research shows that it's the highest rated career sustaining behavior for psychotherapists is spending time with spouse or partner and friends. So one thing you really, we want to remember is that if at any point our outside relationships are starting to deteriorate, we want to lean back into that, right? Because that is a career sustaining behavior, to have that sort of balanced life outside of work. And then also the relationship with ourselves. We really have to nourish that too. Typically, it's that we need more time to ourselves. These days, it depends on your situation, right? For those who are living alone, we have a lot of time to ourselves. For those who are living with families, we might not have any time to ourselves these days if everyone is still at home and not going to school. So, but making sure we have the right amounts of space with ourselves is really important and is a big part of nourishing ourselves and our own well-being. 6th broad strategy then is setting boundaries. This is the most frequent self-care strategy of mental health experts, according to the research, and of course, for good reason. Boundaries, as we all know, are very, very important. And of course, most of us talk with our clients about this all the time, about setting appropriate boundaries. And yet sometimes we neglect or are hesitant to do so for ourselves. And, there's a bunch of ways that we set boundaries. We need to clearly understand our roles and limits as a psychologist or a mental health practitioner. We want to be clear with patients on our policies. What are our policies in terms of late appointments or text or taking calls outside of sessions? What are the policies? And then we need to stick to it. We need to actually hold our clients to it and be firm in that, modeling in some ways appropriate boundaries. Also having caseload boundaries and limiting the number of high-risk clients that we see. And remembering it's okay to say no. If we say no and we feel a great deal of guilt, then that's something for us to look at. That's a piece of work that we need to do on our own, perhaps with our own personal therapist or a coach or a mentor or someone. But that doesn't mean that we don't say no, right? In fact, one recommendation is also to work under capacity, so that you're working usually at like 90% capacity, so that other needs like family, your own personal self-care, they can also be tended to. And I think it's important, when we schedule out our schedules, so often we're looking at how many clinical hours or how many hours am I at the office? How many of you put into your schedule family time or personal time? And that I think we should be putting that into our schedules because that is life too. And if we don't, what happens is, again, our vision gets skewed a little bit only to the work, and we're devoting so much and giving so much of ourselves that we're really neglecting the other. Also, delegating is another way to have boundaries, protecting your personal time with friends and families, those kinds of things. 7 is restructuring cognitions, and there's a lot to this, and we're going to talk a little bit about thinking too when we get to the resilience and neuropsych section, but a lot of this is sort of, partly monitoring our own inner dialogue regarding sort of performance issues and clients, actively working to correct any cognitive errors, making sure we're not getting into catastrophizing or dichotomous thinking. Again, working to avoid that self-perfectionism. So it's really this self-monitoring ourselves for this. And I mentioned the cognitive errors. Also, reminding ourselves that we can't cure every patient. We don't have to work with every patient. Balancing the time we dwell on thinking about our challenging cases with also time that we dwell thinking about our successful or positive ones, right? Nurturing ourselves with the successful and positive ones. Managing appropriately our counter, which of course we all experience at times. And using self-insight and empathy and self-compassion to really manage that. And then also I would say talking with our colleagues as a big part of this as well. Resuming ownership of our choice. And this is a big thing, and we're going to talk again when we get to the resilience parts and some of the avoiding burnout. But remembering that life is complex, sort of coaching ourselves to tolerate ambiguity and increase complexity. Some of the research, when some of the master therapists are asked how they sustain their well-being when working with very traumatized clients, these peer-nominated master therapists say that they specifically and intentionally work to expand their perspective, right? Purposefully reminding themselves to see the wider horizon of possibility and embracing this idea of complexity and tolerating ambiguity. Also then is sustaining, strategy number 8, sustaining healthy escapes. And this is both at the office. So some things to think of there are like, what kind of breaks do you take at the office? Do you take breaks in between session? I know a lot of clinicians who say that, plan to have those 10 minutes in between session, but those either they then run right up, so they're not, maybe they have 2 minutes in between sessions, or they get taken up with phone calls. You got to have a break for you too. If you go nonstop, you're not going to be able to have energy. The research really shows that taking the breaks actually creates more time and energy. Even though it might feel like it's taking time, it'll have the opposite. Also then, other healthy escapes at the office include humor, relaxation. So there's a whole bunch you can do there. And then of course, escapes away from the office, which includes, certainly going on vacations, or even if you're not going away, taking days off, doing staycations if you have to, especially now. But really having time where you get away from work, where you really let go of the burden of one's professional self. You really let it go. You've got to have that space. And I've heard a lot of clinicians now, so many clinicians are, because our work now is portable, right? So their families, or they're taking their families on vacation, or getting a hotel, not a hotel, but like a house, renting a house, whatever. And instead of taking the time off, they're taking their laptops and doing teletherapy, which is maybe fine. But if now, because our work is portable, if that means you're going to do teletherapy all through your vacation, that's risky. And I think we all have to really pause and ask ourselves what that is about. Because we really do have to have a commitment to ourselves and to that time away from work, with our families and other people. Okay. Maintaining mindfulness. And I know I'm going through these a little quick, but I'm noticing the time and want to make sure we get through all the material. So maintaining mindfulness. This is, many of us, of course, are familiar with mindfulness in general, the kind of paying attention, that purposeful paying attention to the present moment in a non-judgmental way. This would include sort of taking brief mindfulness breaks or pauses all during the day. We've been doing some of them with these little exercises we've done. In the last webinar, we did that check-in at the beginning. So even just taking a moment in between sessions or in between phone calls or whatever it is, just 1 or 2 minutes, literally, they can be short, where you just close your eyes and you take those deep breaths and you ask yourself, like, how am I? You just check in with you. And I would encourage in that you also ask the question, not only how am I, you let your body relax, but important, like, what do I need? What am I needing right now? And is there a way I can give myself that? Sometimes the answer is yes, and then I hope you will give yourself that. And if you can't give it to yourself in that moment, then make a commitment in that moment to give it to yourself at some point, maybe at the end of that day or by the end of the week, depending on what it is. But I think we need to get really good at the self-check-in, asking what we need, and very importantly then, honoring that need by being sure that we actually receive it, that we follow through on that part, because that's where I see a lot of us not really good at receiving. And no doubt there's a lot of reasons for that, but that's beyond our scope today. I just want to say other pieces of maintaining mindfulness, certainly mindfulness meditation, compassion. We're going to talk about that, self-compassion, later in just a few minutes. Reflecting mindfully on your work. And again, not just the cases that went badly or where you feel like you made an error or something, or where the patient is upset, but also the cases that are going really well, right? Allow that to nourish and nurture you a little bit. Now, that doesn't mean that your client is nurturing you. That means that your work is nurturing you, right? So be careful. I'm not by any means suggesting that we breach boundaries, but I am suggesting that we take the rewards from our work and allow them to nourish us. Okay, so 10, creating a flourishing environment. Certainly this has to do with the physical environment around us. Things looking at, ergonomics. What is your desk set up? Is your chair comfortable? Do you have things of beauty in your room that enliven you? Or does your office make you feel like you want to scream and run, go running for the hills? Really take the time to create an environment that enlivens you, that you feel comfortable in. Now, many of us will do this in our offices for our clients. Sometimes we're not so good at doing it in our home offices, but I think paying attention to the physical environment is very, very important. Also, a flourishing environment means we may need to get business support. Maybe we need administrative staff. There's various other pieces here. So environment, what is our work environment like overall? Maybe we need more collegial support because we're feeling too isolated. So we want to increase supports and reduce constraints, particularly in organizational settings. And so for those of you who run your own practices and you have employees, or you're leaders in organizations, managers, various things, I hope that you'll be thinking not only about your own self-care here, but how can you help to facilitate the care for the people who are under your business or your management or your supervision? How can you help them? How do we reduce constraints, increase choice? Because the more we can support well-being in ourselves and our colleagues, the more our field and profession as a whole flourishes, which of course helps every single person that we encounter. 11th strategy then is profiting from personal therapy. We talked some about this in the beginning in terms of the barriers, but really important to think about this. If you have any of your own resistances for not wanting to pursue therapy, I think it's good to really confront those. What is that about? And is that true? Because sometimes we just don't allow ourselves things that would be really, really helpful. And also be aware of that potential illusion that we as psychologists or clinicians don't need therapy, because that is a myth. And you may, as someone says, practice what you preach. If therapy is good for your clients, it could very well be good for you also. And it doesn't mean, going to therapy doesn't mean that we're impaired or have a problem, but all of us know that therapy can be enriching in a personal and professional development way too. And so I just encourage you to think about that. And then the research does show that personal therapy is emotionally vital and professionally nourishing. So this is a really key way that we can care for ourselves and for our clients. And then practice what you preach. There it is. All right, number 12, cultivating spirituality and mission. Sorry. Identifying, well, before we get there, this sort of the broad sense is you want to connect with any spiritual sources of hope or optimism that you might have. Sorry. Identify and resonate with your mission. It doesn't matter what you believe in spiritually, but what is your mission? What do you believe about why you're here and what your purpose is? What is it you're trying to do, not just in work, but in your life? All of that. Cultivating awe and wonder at the human spirit. You know, there's incredible awesomeness in the human kind of being. And we as clinicians are privileged to see that every day if we're tuning into that. As I said before, connecting to spiritual sources of hope and optimism. And if you don't feel them, if you can't find them, then seek out a therapist or a mentor or someone, because that's a sign that you're towards that right end of the continuum. And then, of course, deepen the meaning in your own life. And there's lots of ways to do that. But that, again, that is what vitalizes us. That's what enriches us. That's what makes us come to life. And that is a source of energy that can energize and be the fuel on which we continue doing our work. And the 13th strategy then is about fostering creativity and growth. Creativity, right, is about innovation. You can do this in terms of our own practices. We can change the way we're working. So we can, instead of just doing sort of work tasks, maybe, you know, frontline clinical work, maybe we start doing supervision. If we've been doing only individual treatment, maybe we mix it up with some group or family. Maybe we change the population, but we want to sort of keep new things going. We want to diversify our work so that we're not only doing the one thing over and over and over again. That can lead to burnout. We want to enlighten it a bit in ourselves. And then growth, right? And this is about really attending to our professional growth, making sure that we find ways that we continue to develop as a professional. Maybe that's going to CEs or writing research papers or doing trainings, whatever that is. And then we also continue our personal growth as well. We continue to develop as humans. And of course, both feed each other as well. Okay, so very quickly then, before our next break, designing your own plan. What of any of those strategies we just went through are you already doing? Those 13 strategies, the broad strategies. Which ones might need strengthening? Identify a couple of those. Which ones might need creating? Which ones have you just not tended to at all? You can identify a couple of those. And I think, you know, this question is great. Like, which one piques your interest? Because go with that. If as we went through those, you're like, oh, I should do more of that. Well, then listen to that, follow that, because anything that sort of piques your interest and gets you curious, there's energy in that. So follow that. That can help to enliven you. But I do want to say I had a brief opportunity to read just some of the feedback in the Q&A. And I want to just speak for a moment to those of you who may be feeling this as stressful or feeling like, you know, you're not doing enough or that you have to be perfect. And I really just encourage you to stop that thinking, to pause that. That is exactly what I mentioned in the beginning. That's that self-critic, self-blame, self-judgment, and that is deadly. It is a deadly trap. So I really invite you to let that go. And again, lean in here in an open way, not in a self-critical way, but in a, is there something I can do that can help me with anything, with one tiny thing? I by no means am saying that you have to do all of these things. I am providing you opportunity to look at ways that you could expand your self-care, that will enrich and enliven you, that will nourish you, that will help you get to that flourishing end of the continuum. But yeah, absolutely. If that self-critic comes in and says, oh, you have to be perfect, you have to do all of this, well, then that is the exact opposite. So one thing there is going to be maybe looking at that self-critic and seeing if you can find a way to step outside that. And we're going to get in just a moment, a couple of minutes, to the self-compassion piece, which I think I really would invite you to bring in, and we'll talk about that because it can be a really fabulous antidote to that. So I just wanted to comment on that. Okay. So the professional greenhouse, and I'm going to go a little bit faster because I want to make sure we still have some time for questions too. This again comes from Skolvold and Trotter Matheson, where they're talking about creating this professional greenhouse at work. And these are the pieces that are needed in order to create it. So at work, there has to be a learning environment where clinician growth is encouraged. And again, for those of you who run groups or practices or are leaders in organizations, please consider if you can institute some of these at your own places. Learning environments where growth is encouraged, that creates energy and vitality. We want a leadership that promotes the balance between other and self-care, that leadership from the top down is promoting that balance, is leading that, where there's professional social support of all kinds, where we as the clinicians can receive other care from our mentors and supervisors and bosses, and where we can be nurtured by providing mentorship and supervisions to others. And a big one, and we're going to talk more about this, is play at work. Play, now professional play, we have to be able, we're not going to, I don't know, there's all sorts of things we're not going to do at work, but we can still engage in humor and fun, and, we can liven it up, and that is critical. And then, of course, we should also play outside of work. And so looking at play more specifically, Stuart Brown, he's done a great deal of research on play. He's written a book on play, done a lot. He's very knowledgeable in this area. This is his area. And here's how he defines play. Play is apparently purposeless. It is voluntary. So purposeless, right? It's done for its own sake. It's voluntary. We're not obligated. We're not required by duty to play. It's inherently attractive. It's just fun, right? It makes us feel good. It can be a cure for boredom. There's freedom from time in play, right? When we're fully engaged in play, we lose that sense of time. There's a diminished consciousness of ourselves, right? We stop worrying about how we look, or are we good or awkward or smart or stupid. We just engage in play. There's improvisational potential. We don't get locked into a rigid way of doing things. It allows us to step outside in a way of our normal activities. And play makes us want to do more. It makes us want to keep doing it. It's the pleasure of the experience that drives us wanting to do the experience more. Similarly, Johan Huizinga also talks about the definition of play that describes it as being free activity, standing outside, again, that ordinary life. It's simultaneously not serious and yet also utterly absorbing, right? There's no material interest in it, right? It's not for profit. We're just playing, again, because it's fun. It has its own boundaries of space and time, and it promotes social groupings. So there is a tremendous benefit to play. And there's so much research. Again, I can't include it here. I'm going to go through some brief highlights to give you guys hopefully a full prescription to go play more. Play has been shown to release endorphins, improve brain function, improve memory, and enhance coping. It's also been, and this is adult playfulness, robustly associated with life satisfaction and well-being. It is critical for sustaining social relationships and for creativity and innovation. Dr. Brown talks about if we don't play, then we're not going to be able to be innovative. And so for him, when he's working with CEOs and companies that are trying to, have increased innovation, one of the things he says is you have to play more. That is how you get to that. And it is scientifically proven to be useful. There was, multiple studies show this, but one of the ones that I think is really kind of fun is the Alaska grizzly bear study. And this was a study done over about 15 years on bears in Alaska. And what was discovered is that it was the bears that played the most were the ones who survived best. I just think that's fabulous. And that was true despite the fact that play took away time from other, like what we would typically think of as survival activities, like finding food and eating. And so clearly play is doing something that is related to our survival, even though, you know, it's obviously not sort of finding food and those kinds of things. But so lest you think that play is not important, it's actually really critical. This is a quote from Brown from his book. Play is nature's greatest tool for creating new neural networks and for reconciling cognitive difficulties. And that new neural networks we'll talk more about in the resilience, but that's really key. If we want to continue to grow and enliven ourselves and land in that flourishing category, we have to change our neural networks. We have to be heading in that direction. So play is a fabulous way to do that. He also states, play is how we are made, how we develop and adjust to change. It can foster innovation and lead to multi-billion-dollar fortunes. But in the end, the most significant aspect of play is that it allows us to express our joy and connect most deeply with the best in ourselves and others. So play. I hope you guys will go out and play this weekend and really think about lots of different ways to play. Now, this is where we were going to do one more of the final sort of meditation exercises called Care to Play. I'm going to hold this because I want to make sure I get through the rest of the material. And if there's time before our Q&A, we'll come back and we'll do this one because it's a fun one as well. But I don't want to run out of time either. So we'll come back to that. Okay, benefits of nature. So these are additional sort of, you know, and additional things that we can add in. And they're sort of techniques, I guess, although that sounds harsh, but you know, they're found in Van den Boss's strategies, just in different locations, right? We can fit them in lots of different ways, but really important, play and the benefits of nature. Nature has been shown in studies, it's been linked with improved attention, cognitive benefits like working memory, flexibility, attentional control, lowers stress, improves mood, reduces risk of psychiatric disorders, and it increases empathy and cooperation. So much good can come from being in touch with nature. In the Lee et al. Study, students were asked to engage. They set them up doing this dull attention. It was just an attention draining exercise task. It was very dull. They had one set of students look at a flowering green roof for 40 seconds. So pretty short time frame. They looked at that midway through the task. And the other students looked at a concrete rooftop. But what they found is that just those 40 seconds of looking at nature, those students who did that made significantly fewer mistakes. Also then, contact with nature has been associated with increased happiness, subjective well-being, positive affect, positive social interactions, a greater sense of meaning and purpose in life, and decreased mental illness. So, wow, I wish we could be having this workshop outside, right? There is some evidence in the literature that just seeing images of nature can be beneficial. So, you know, possibly just including images in our offices can help. And this is a really interesting study. It's pretty new too, done in 2019 from White et al. And a very large sample, it was over just under 20,000 people. And what they did is what they found is that individuals with at least 2 recreational hours in nature a week reported significantly greater health and well-being. Now, what was interesting is that this pattern was consistent across groups, including also older adults and those with long-term health issues. And it didn't matter how those 120 minutes were achieved. So maybe it was one long hour and then another long hour, or possibly it was multiple, like shorter 15 minutes over the course of a week that added up to a total of 2 hours. So it didn't really matter. It just mattered that if they hit that 2-hour mark, the 120 minutes, that's where there was this significantly greater increase in health and well-being. So I think that is really important for us to know, because most of us can find some time in nature, whether it's a park or being in our yards or hiking in the wilderness. I know not everyone has access to wilderness depending on where we are, but nature can be really, really powerful. All right, so self-compassion and resilience. I really wanted to look at both of these because they're so important. There has been a ton of research on self-compassion. I mean, literally thousands and thousands of articles. I mean, it's really just this burgeoning explosion of research. And I clearly am not going to be able to cover all of it in just the few minutes we have left, but I want to get you enough so you can really see some of the significant pieces and how this can make a big difference. All of the literature, all of the studies are really showing really significant impacts from self-compassion. Much of the stuff I'm going to tell you today is based largely on the work of Kristen Neff and Christopher Germer. They both are founders of the Center for Mindful Self-Compassion. I'll talk a little bit more about that in a little bit. Compassion, basically, self-compassion is compassion turned inward. It is really treating ourselves with care and concern when we're confronted with anything like personal inadequacies, mistakes, failures, difficult life circumstances. So it's really the kind of compassion that we would show to a good friend. It's really doing that for ourselves, really turning that to ourselves, and in essence, so both sort of being a good friend to ourselves, but importantly, allowing ourselves to receive that. And again, I think that allowance of receiving is sometimes very hard for us. Self-compassion has three components. The first is self-kindness, as opposed to self-judgment. And this is where we offer warmth and unconditional acceptance to ourselves. Again, treating ourselves as we might a dear friend who is experiencing the same thing. If you think about, and there are videos online, where we talk about, or they talk about sort of the things that we say to ourselves, we would never, ever say to someone we love, to our child or our spouse or our good friend. And so, getting mindful of that self-judgment and instead treating ourselves with kindness. The second component then is common humanity. And this is really recognizing that all humans are imperfect. It is the human kind of being to be imperfect. We all make mistakes and face challenges in life. And by remembering this, that can help us feel less isolated when we're in pain. Just the knowledge alone that when we've made a mistake, it's not that we're a failure, it's that we are human, and that is okay. Others have made mistakes. We are in amongst a very good crowd, the crowd of being human, right? And mindfulness then, rather than over-identification. This is really being aware of our own painful experiences in a balanced way. It's neither ignoring or avoiding our painful experiences, nor is it exaggerating painful thoughts and feelings. It's just being mindful. Self-compassion has been found to be a robust resilience factor. It also affords greater emotional resilience and increased personal responsibility for one's health and lifestyle choices. There's been really interesting work done on some of the increasing motivation we're going to get to in just a minute, but it also has been consistently associated with lower levels of depression and anxiety. And individuals with high self-compassion are less likely to ruminate on their own negative thoughts or emotions. And for those of you who were in seminar 1, you'll start to see that some of these things, right, are associated with burnout, the depression, the anxiety, the negative rumination, those kinds of things. So here we have research that's showing that self-compassion can directly target those things. There's also multiple studies that show a link between self-compassion and things like happiness, optimism, curiosity, personal initiative. There's this idea, this sort of misconception that if we're self-compassionate, it would lead to self-indulgence, right? But what the research is bearing out is that it's really the exact opposite, that in fact, greater self-compassion enhances motivation for things like changing behavior, trying harder to learn and avoid past mistakes. And there's been a lot of different research on self-compassion as helping to motivate health-related changes. So things like starting a diet, stopping smoking, starting fitness routines, that self-compassion actually can increase the motivation and follow through. It is negatively associated with maladaptive perfectionism, which, as we know from the last workshop, is associated with burnout. And self-compassion also provides emotional resilience, in part because it deactivates the threat system and activates the caregiver system. It is also a skill that can be taught. So really powerful. This is really powerful stuff. And it's funny because in some ways it's also so simple, but the impact is far from simple. So it's related, of course, to psychological flourishing and to reducing psychopathology. It facilitates resilience by moderating our reaction to negative events that we encounter. Key here, self-compassion does not push away negative emotions, nor does it attempt to replace them with positive ones. That's really important. We're not sort of ignoring or trying to replace our negative emotions or experiences. Instead, what happens when you practice self-compassion is that positive emotions are generated by embracing the negative ones. There's a real embrace of who we are and our own experiences, and a kindness and compassion for that. And that is what produces the positive emotions. In a randomized control study, this had to do with psychologists in particular, 51 of them in a training group, 49 on a waitlist control group. There was self-compassion training that was 15 minutes a day, 6 days a week for 6 weeks. And what they discovered is that the levels of perceived stress and burnout were significantly lowered in those who were in the self-compassion training group. So there's increasing literature showing that self-compassion, practicing self-compassion, can directly target burnout, compassion fatigue, those kinds of things. Also recently, there were 2 studies by Neff showing that this is a particular training for self-compassion for healthcare communities, that training that she developed increases self-compassion and well-being, and that the gains are maintained, in this case, at least for 3 months. And then it also helps to significantly reduce secondary traumatic stress and burnout. So again, a lot of really good information and research coming out. This is one more meditation. If we have time, we'll come back to that. It's a really lovely, if we don't get to it, I encourage you to Google it. Compassion with equanimity meditation. It's really lovely for helping us with sort of compassion fatigue in our work. And it's really meant to be used in actual caregiving situations. And so I will tell you that part of what the phrases that we repeat to ourselves in that meditation include, everyone is on his or her own life journey. I am not the cause of this person's suffering, nor is it entirely within my power to make it go away, even though I wish I could. There are times when this relationship is difficult to bear, yet I may still try to help if I can. So it's a really lovely meditation. I don't think we're going to have time today, but I want you to know it's out there, and potentially to give it a try. It's actually a part of the mindfulness self-compassion training that is done through the Center for Mindful Self-Compassion. That is their site. This is also something from their website where they talk about a quick way to tap into self-compassion in any moment is to ask these 3 questions. What do I need? On my worst days, what helps me feel supported, and how can I remember this? On my best days, what helps me feel grateful and content, and how can I remember this? So again, really quick tools that can have a really powerful effect, really powerful. Okay, some quick information on resilience. APA defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, and even significant sources of stress. It's really about bouncing back from difficult experiences, and it involves personal growth, right? So it links very well with self-care, because self-care also involves personal growth. Of course, it does not mean that we're not going to encounter hardship, right? Just because we're resilient. In fact, probably, becoming resilient means that we have faced some hardship and will be facing more. But it does increase our ability to weather and grow from those challenges. Many of you are likely aware of some of the research on neuroplasticity, which is really fascinating and I think offers significant hope and optimism. Neuroplasticity is really the ability of our nervous system to basically reorganize its structure and function and the connections in the brain. And I love this quote it's actually from Chopra and Chanji's work, but quoted in Southwick and Charney. They say, neuroplasticity is better than mind over matter. It's mind turning into matter as your thoughts create new neuronal growth. And that new neuronal growth is really where we can see so many benefits. These are 10 resilience factors that are talked about by Southwick and Charney. I'm not going to be able to go into details for each of them here, but I think it's good to see them. And you will start to, as we go through this material, you'll start to see repeating themes, both from the self-care material that we've already talked about, from that self-compassion material, and then these resilience things. But fostering optimism, that's ourselves fostering it in ourselves, facing our fears. This solidifying moral compass is related to another idea we're going to talk about in a minute with intentionality, but also in Norcross and Vandenberg, they talk about this as, finding our mission. So it's there in a lot of different ways. Again, the idea of religion and spirituality come up. So enhancing cognitive and emotional flexibility, finding meaning, purpose, and growth, all of these are resilient factors that we can actually increase. All of these we can grow. This is from Rick Hanson's work on resilience, and he talks about how do we grow resilience in essence? The resilient skills are things we can grow. And he says the key to growing any psychological resource is having repeated experiences of that experience that get turned into lasting changes in our neural structure. So again, it's about that creating changes, that creating the new neuronal growth in our brains. He says that in order to do this, it requires two things. One, an experience of what we need to grow, meaning like the actual experience of, say, love or comfort or gratitude. So whatever that experience is, we have to have it. And he refers to this as activation. And then we have to have that experience and convert that passing experience into a lasting change in the nervous system. And he talks about this as installation. That it's not just that one passing experience, that we can take that one experience and we can convert it into a lasting change in our neurons, literally. Interestingly, we can either notice that experience of, say, gratefulness or being loved or comforted or having confidence, or we can create it. So if we haven't had it, we can create it. And again, another great quote by John is neurons that fire together, wire together. And that's really important because that's what we're doing when we're creating this new neuronal growth. And so Rick Hanson talks about the 4 steps to doing this, 4 steps. How do we get these psychological resources that we need, so to speak? And these steps are based on learning. Like, this is what the neuroscience is showing, how we learn and how learning changes their neuronal structure and functioning. Happens again in those 2 stages that I mentioned before, activation and installation. And what he says, the 4 steps, the first is H, it's HEAL, HEAL is the acronym. The first one is that we have to have a beneficial experience. And again, we can notice or create it. So it can be an experience that we notice we've had today, for instance, or if I haven't had that experience today and yet I want to focus on it, I can create it in my own mind by imagining it. The next step is then we enrich that experience. We stay with it, we feel it fully. And there are ways to enrich it. we can lengthen it, we can intensify it, we can in our own mind sort of, a lot of what we were doing earlier, feel it in your body, those kinds of things. Then absorb it and receive it into yourself. Again, see that the focus on receiving, we have to take this in. And the last one for him is linking it. And this is optional. There's a lot more detail to this that I can't go into in our time, but the idea is that we ultimately link these positive or resourceful experiences with something that is more harmful or difficult for us, and that we're using them to soothe and replace that painful material. But there's some cautions that you have to do. We have to be careful not to get hijacked by the negative experience. So there's more details there, but it's a really interesting idea. And so he talks about, like, one example he gives is finding your refuges. So if you think for a moment, like, what gives you refuge each day? Where are the places you go for refuge? Maybe is it taking a shower in the morning? Is that a small place of refuge, right? Where no one's bothering you? Can you find refuge when you cook dinner? Or is it listening to music somewhere? Or is it maybe listening to your child tell you a story and watching them come to life in their own way? Is it taking your dog for a walk? Or is it those moments right before you go to sleep? Whatever it is, you can use this method, right? Slow down, feel that refuge, stay with it longer, really, again, lengthen it, intensify it, and then absorb it, pull it into you, let it really sink in, let yourself receive it. And if we do that over time, right, neurons that fire together, wire together, we're creating new paths in the brain. Also then, I wanted to talk for a moment about Gentry and Dietz's resilience skills. They have 5 of them. And again, I can't go into great detail, but they are in their books, which are in your reference list. You'll see a lot of overlap. The first one is, these are the 5 resilience skills. One is self-regulation. And this is really, again, where we are regulating our bodies, right? Discovering that when our body's physiology is calm, right? We want to notice when our bodies go into a threat response, when that gets activated, and then we want to actively and acutely relax our muscles so that sympathetic nervous system is no longer dominant. This kind of self-regulation, they give multiple examples of how we can do this. Some are very, very quick. Teaching our bodies to literally relax in 5 seconds. These are skills. It does take practice. We do have to practice them, but it can lead to an immediate lessening of distress and a restoration of comfort in our physical bodies. And not only will that alone bring relief, but also this skill of self-regulation is essential for the other skills. So it really is required. And it's something that we can do. They actually say that, we want to develop, do this during the day, hundreds of times during the day, but for 1 or 2 seconds, right? So as many times during the day as possible, just tune into your body and relax all of your muscles as quickly as you can for 1 or 2 seconds. And the way they talk about it is they don't want us to pull out of our life to do that. They want us actually to relax our body in the midst of life. And that's a kind of resiliency training for our body. That can make big, big difference. The second one then is their concept of intentionality. And this really has to do, the way they talk about it is of living with fidelity to our purpose and in alignment with our principles. So it gives us this sort of overarching mission and kind of a code of honor by which we live. So some of those things, again, you'll see in Norcross and Vanden Boss's work. And they talk about really writing this out and or speaking it. And really making it concrete. The third then is this concept of perceptual maturation. And recall, for those of you who were in seminar 1, right, Audrey and Gentry talk about burnout as the chronic condition of perceived demands outweighing perceived resources. And so this has a lot to do, their phrase perceptual maturation has a lot to do with shifting from that external locus of control to an internal locus of control. It's remembering that we have choice. No matter what, we do have choice. The more we talk ourselves out of that, the more we're going to talk ourselves into burnout. But the reality is that we do have choice. And so turning, changing some of the way we're thinking about things and our perception can have a significant impact on our resiliency. Fourth step is connection and support. We've talked a lot about that today. Functioning in an interconnected way, developing and utilizing support networks outside of ourselves that we can turn to for support and feedback. And then the last one is self-care and revitalization. And, again, this is a lot of what we've talked about. I know I see Jana coming on, so she wants me to, so I'm gonna end there because I think that is good. And Jana,
but don't stop sharing your screen. We've had an overwhelming request to make sure that you please make time for the exercise that you said you would get to if we had time, the play exercise.
Oh, the play. Okay, so let me actually go back to that slide. So we will do that. Okay.
Okay, great.
I will do that real quick and then we will take questions. Okay.
Right.
So the care to play. Again, just take a moment, close your eyes, take a few deep breaths. Relax your body, really intentionally relax your body and breathe. Feel in a way as if you're sitting in a warm bath, right? You can just literally feel the knots of tension dissolve with each breath. So inhaling calm and relaxation and exhaling all of the tension. As you start to feel relaxed, allow a memory of a happy or funny moment to come to mind. Funny moment, it could be in a session with a client or outside, but a moment where you and this other person, whoever it was, you were genuinely laughing. You were right. A child, just so. Allow your breath to be natural and easy, and stay with any images and sounds associated with this memory. Just let it, again, lengthen it, enrich it, feel it in your body. What do you hear? What do you see? What do you feel? As the scene unfolds, recall how you felt during the experience. Let yourself savor the delight or even the exuberance. And allow these feelings to spread throughout your body and mind. Allow an inner and perhaps even an outer smile to form as you feel them. As the delight strengthens, let go of the images, but hold and breathe into the sensations of playfulness, the ease that you've conjured. If tension or other kinds of thoughts creep back in, simply return to the images from your memory. And when ready, return your attention to your surroundings and continue to savor the feelings. And then you can come back to here. So that is the exercise. I'm sorry, it was a little bit rushed, but I hope you still got to enjoy that. Jan, I know we're going to do a few questions. I'm going to go ahead and stop sharing my screen, or?
Yes, let me just make one comment. Folks can see on this slide where they can find that someone asked about a script or to have a link. Again, it's a part of the anti-burnout card deck. So the reference is in your handout. So now you can stop sharing the screen. Thank you.
Okay, great. Yeah. And also, if you go to Google and just Google the anti-burnout card deck, you'll find it. It's very readily accessible.
Great. Well, so we have some time for some questions. Going way back towards the first part of the presentation, someone asked, what does flourishing look like? What are some examples?
Yeah, that's great. Well, of course, flourishing might look different for different people in terms of concretely, but it's basically sort of broadly, it's being alive, fully alive. You're vital, you're energized, there's a kind of happiness. And I don't mean only happy. It's not that, because we can be flourishing and experiencing difficulties at the same time. They're not, it's just that inside we are present, we are here, we are open to awe and wonder, even in difficult times, right? We can laugh and play. There's a way that we're just, in some ways, more fully human in a sort of flourishing way. And it carries that exuberance too.
Great. Then there were a bunch of questions about the constellation groups, consultation groups, and how to find them. So I'm going to kind of merge a couple of questions.
Sure.
One of them is, for those of us with limited contact with other clinicians and who have struggled to find such a constellation, do you have any suggestions? And then another part is there's a dilemma when one shares in a constellation group and one reaches a level of incompetence and won't admit to it and harm results. What does a support group do?
Great questions. So to the first question, in terms of resources, some of that, of course, is going to be getting connected in with your colleagues wherever you are. So some options for that, certainly checking in with your state psychological association. If you're a member of that, lots of them have listservs where members talk back and forth all the time. That's a great way to connect in. You could put a message out saying, hey, I'm looking for a consultation group. I want to create one, or I want to join one. My experience with those listservs, both personally and from talking with colleagues, is that people are really responsive on those listservs. So I think that's a great way to connect in. Certainly going to CE events. Now I know right now they're all on Zoom, but hopefully at some point we'll be able to get back in person again. That's another great way to do some of that networking and connect in. And just reaching out and asking people, hey, I want to start a new consultation group. Who wants to join me? My guess is you'll find other people who are really interested in doing the same. And that latter question, Jana, is really a great question and super important, because I think, in order for us to really do this whole idea of, communitarianism or competence constellations, there is both that, there has to be that sort of non-judgmental support, like how can I help and how can I assist you, I and we, right? And there also is that ethical responsibility we have to make sure that patients aren't being harmed. So I think it's sort of twofold. One is us personally, we need to remember that when people are giving us feedback, we should really look at what that means, right? For our own response, we don't want to simply deny, like, no, that's not true. I'm not listening. We need to take responsibility to ourselves, that if we get feedback of any kind, that we honestly look at that. Now, we may decide we disagree, but we may also, if we're honest, we may see, oh, they may be right. And so that's then our work to do. And maybe we go to a therapist or whatever, but we do that. So that's one piece. I think all of us, if we all do that, that helps.
Right.
The other side of the equation, of course, is what we do when we see a colleague who we know is truly impaired, and despite all of our efforts, that colleague is not seeing it or not willing to make a change, and we know that someone is being hurt. So in that case, there are instances where we may have to call the licensing board, depending on the degree of harm, but certainly before then, I think saying to that colleague, hey, you are forcing me, you are tying my hands. I don't want to call the board, but nor can I allow, and nor do I think you want to allow your client to be harmed. So can we work together on this? Or are you going to force the hand? That kind of thing. It's these difficult conversations that we have to have. And then, of course, getting support for ourselves around that. This is challenging. I think it is something in our field we really hope we get better at.
Yeah. Thank you. On a different end of the continuum, I'm curious about the 2 hours of recreational activities. Is this specific just to being in nature or to being physically active?
No, it's just being in nature. You can be sitting in a park, you can be jogging through the woods. So it doesn't matter your physical activity. It's literally being in nature. Yeah,
Mhm.
great question.
Yeah. And then related to one of the latter topics, is there a reference for the Alaska grizzly bear study?
Yes, I thought it was in there. It's by the Fagans. It's also talked about in Dr. Brown's book on play, and that is also in your reference list. Yeah, it's a
Okay.
fascinating. I will tell you, in his book on play, there's a lot of really great studies.
Mhm.
Dogs playing with polar bears, really fun stuff. So,
Right. I have one
this,
more
I mean,
question.
I'll just say the science is bearing out that play is it's really important for us. So, it gives
Right,
us
right.
to go
And
play.
it was no slip of the tongue that you said that the research is bearing it out,
Yeah,
right?
right.
Okay, one more question and then we'll go to the CE. Any suggestions of how to screen out for less high risk clients? It's sometimes obvious by the specialization list, but sometimes you don't know that a person is high risk until the intake session. If you don't realize it until the intake, what suggestions do you have on how to handle referring someone at that point?
Yeah, so a couple of things. One is you can, now again, all of these are personal decisions, right? I don't know how your practices are run, but one option is to do a sort of very short phone screen. So, to have like a 10 or 15-minute conversation with someone, just to, can you tell me a little about what's going on? I want to make sure we're a good fit, that this has to do, I can provide services, whatever language you want to use. But that sometimes can get you a feel for the person, and you can often pick up on things there that you could then ask more about or not and know, okay, this doesn't sound like something that would work in my practice. And you can refer out at that point. The other thing that I do recommend is once someone gets there for intake, I think it's a really good idea to say to people who are coming in for intakes, look, the first 2 or 3 sessions
Mhm,
are really an assessment, right? Where this is us, I'm going to get to know you, you're going to get to know me, and we're going
mhm,
to spend those couple of sessions deciding whether or not it makes sense for us to work together, if it's a good fit. Um, I would recommend putting that in your informed consent document too, that it's really clear to people. You can say it on the phone, you can say it in your informed consent, you can put it in your writing, that, this isn't, I'm not saying I'm going to work with you forever. I'm saying we're going to come in and meet and see if it makes sense to work together. And at the end of those 2 or 3 sessions, we'll make that decision. And if the
mhm,
decision is that it doesn't make sense for us to work together, then I will give you appropriate referrals. And I think
mhm.
that's a really great way to set it up, because it sets up that expectation. It helps avoid people getting really clingy, like, you told me we were working together, those kinds of things. So.
Yeah. Well, and it also is good for the client because if the client doesn't feel like if it's a good match, it allows them an easier way out, a more professional and appropriate way to terminate the therapy without feeling necessarily inappropriate.